Carlson from Pinnacle Health, and Triplets from
Okay, wonderful.
So we're here this morning to request the use of existing funds to pay for the startup costs and renovations for the opening of the Child Advocacy Center here in Lebanon County in the amount of $50,130. The county share of that would be $10,026. This would not increase our present budget. We have money to cover that, and we don't anticipate any additional costs. The Samaritan Hospital will be providing the building, which is located at 618 Cornwall Road, and Pinnacle Health Services will be providing the services for this facility. We presently use the Children's Resource Center out of Harrisburg for these services for the victims of child sexual abuse, and in some cases those of serious physical abuse. The benefit of having something locally would increase or improve the professional services for these children, increase the number of services we could provide to them. It would involve medical examinations and also forensic interviews. The benefit of a forensic interview is the fact that it is a comprehensive interview by a trained forensic interviewer. The interviews are taped. They're witnessed by caseworker, children and youth services, and the law enforcement official. Those tapes then can eliminate the need for children going through traumatic experience in multiple repeated interviews. The tapes can also be used in court proceedings, in the prosecution of the offender through the district attorney's office and children and youth services. We would also anticipate using the forensic interviews to assist with children who have witnessed serious major crimes such as homicide, attempted homicide, serious domestic violence. We're anticipating, or would like to open the facility no later than July 1st of this year. We're looking at 1 to 2 days per week if approved by commissioners. The state has approved the funding for this facility, and in my opinion, this is one of the better things that we would like to start with victims of child sexual abuse in this county for many, many years. And it's also been an outstanding collaboration with the district attorney's office, our agency, Good Samaritan Hospital, Pinnacle Health, SARC, North London Township Police Department's on the committee, and Lebanon Family Health Services. My hope and desire that you would approve this funding so we could make a Child Advocacy Center a reality here in Lebanon County. Certainly entertain any questions that you may have.
All right. Megan, do you have anything to say?
You know, I think from the practical perspective of being the prosecutor who handles most of these cases, I've seen a huge benefit that the kids have gotten who have been able to receive services from Children's Resource Center. And unfortunately, with finances and transportation issues, there are times where people can't actually get there. But going up to the Children's Resource Center, you know, there's this one interview that's done. Everybody's involved. The child's not being interviewed over and over, re-traumatized every time they've had to talk about it. And additionally, they get medical care, which from my perspective is a big deal. Even in situations where, and in most cases, children don't come forward right away. So getting that additional medical care from the Children's Resource Center is helpful. And we've seen situations where children have been abused and they've ended up having sexually transmitted diseases but didn't know about it. And luckily, we've been able to get them up to the Children's Resource Center. And the medical staff, Dr. George and all the other ladies, have done a really great job of getting the kids through it, getting them on the necessary medication, and providing them with education about it as well. So I think that that's a huge positive. You know, and it allows us to really collaborate as a team, which is what we're supposed to be doing. And again, when I take cases to trial that have been to the Children's Resource Center, I have that forensic interview, and if the child's 12 or under, the jury 9 times out of 10 gets to see it. And that's a big deal because, you know, it's when the child's initially disclosing, it's really close to that time frame. They get to hear from Dr. George or one of the other medical staff, and the doctor really explains to the jury why there's not going to be some sort of injury to that child, and that it's a myth to have that expectation. So I've seen juries really relate to the testimony from the forensic interviewer as well as the doctor when it comes to their contact with the child. It also eliminates any argument that the child's been tainted, because again, you've got this wonderful video that tells you exactly what was asked, how it was asked, and how the child responds. You really can't argue with that. It speaks for itself. So I think this is something that we've been working on for a long time, and it's fantastic that we're at this point. I only see it as being a great thing for the community.
Thank you. Dave?
I have nothing to add. They both, I think, said everything very eloquently. I'm very excited for this opportunity. It's been a long time in the works, and hopefully, we can move forward with it.
Jenny?
Well, this has been a dream for SARC to see a Children's Resource Center for many, many years. To be right at the door of a center is essential for all of our children here in Lebanon County. Sending children to Harrisburg is an excellent program, but it is something we can do here, and we can do it well. And I know that we're going to do that.
Is there anybody else to comment on this
Pinnacle.
particular issue?
Lynn Carson.
Linda, thank you.
It's Lynn Carson. Well, as the manager of the Children's Resource Center, we do see a fair number of children from Lebanon County, and we just, when we spoke about the opportunity of having a satellite office here, it just seemed to make sense rather than starting a whole entire new Child Advocacy Center. We're able to use our expertise and reputation and to work with the community. Again, as Megan said, that's really what the design is about. It's collaboration in the community. And I feel like this has been such a great collaboration, even especially between like the DA's office, but Good Sam and Pinnacle Health being able to come together has been great.
Great. As a mother and grandmother, I certainly appreciate the efforts here and all the diligent work, Jim, and that your staff and everyone here has put together. Thank you. Anyone else care to make a comment?
No, I just, certainly just the proximity, the location is, a marvelous improvement. So that in itself should benefit, so.
I know this has been many years in the making, and I also appreciate the number of disciplines that were brought together to make it happen, and that's always good to see from our side that different constituencies are represented, and also the players are working together to make it happen. So thank you.
John?
Yeah, I heard some dollar figures thrown around at the outset, but I really didn't follow them. You said 10,000 commitment from the county?
The total cost would be $50,130. That's the overall. The county share would be $10,026. Roughly 20% of that. The state will pick up the remaining 80%, and the state has approved those expenditures.
What department of the state?
Office of Children, Youth, and Families.
Thank you.
Okay, is there a motion?
So moved.
Second.
All in favor say aye.
Aye.
Opposed, same sign. Motion carries. Congratulations, and we
Thank
look
you.
forward to the opening on July 1st.
Thank you very much.
Thank you.
Appreciate it.
Thank you.
Thank you very much.